Go ahead, ma'am.
Good afternoon, everyone. This is Dr. Poornima Mathur from Oasis Fertility. My best wishes to all my fellow countrymen on the 77th Independence Day. Now, our country has come a long way since 1947. And as our Prime Minister, Shri Narendra Modi ji, rightly mentioned in his speech, that the India has now become the fifth biggest global economy worldwide. And the major credit to this goes to the youth that is working day in and out to achieve this difficult target. So let's talk about ये जो हमारा youth है who's working so hard, toiling so hard towards their career, towards the country's goal of achieving a major global economy position. क्या इनकी personal life at some aspect affect होती है? And if it is affected, do they have any freedom or say to manage it or control it as per their requirements? So let's talk about that. Whether or not the youth today or the couples today have the freedom to plan their pregnancy so that they can have a stress free, without any complications course through their fertility journey. So usually it is a very common situation for most of the working women कि वो एक dilemma में stuck होते हैं whether to choose their career or their personal life, always trying to maintain a delicate balance between it, struggling very hard to maintain this balance. So the main question here comes is like, do I have to struggle with this? Why is it that my career and my personal life have to be the most prominent part of my life at the same age? Now, if I delay things, अगर मैं अपने career पे focus करती हूँ and मैं fertility delay करती हूँ, तो can age affect my fertility? Will it cause any problems in conceiving later on? So age does have an effect on your egg reserve. Now, when we talk about egg reserves, that is हमारे जो अंदर eggs हैं, the gametes that are there, जो हमें baby बनाने के लिए चाहिए, to achieve a pregnancy चाहिए. So we'll go into a little detail when we're talking about egg reserve a little later in the presentation. It does impact the quality of the sperms as well. Sperms, we mean we're talking about the male counterpart, the husbands. Plus, there are other factors which come into play. जैसे there are कितनी सारी medical illnesses होती हैं which increase with aging, जैसे diabetes, heart diseases, hypertension, obesity, and इन सब का impact आता है on your fertility. And कहीं ना कहीं on the pregnancy outcome as well. जब हम देख रहे हैं, we are looking forward to not just getting pregnant but delivering a baby as well. So we are talking about the 9th month journey. Final outcome हमारा baby कितना healthy होता है. So, are there any ways जिससे हम इन adverse effects of aging को negate कर सकते हैं? We can counter them or in fact थोड़ा सा उनको कम कर सके so that they do not have a major effect on our future fertility potential. Rightly said, अगर ये सब factors हैं, so what would be the right age for planning a pregnancy? And अगर कोई right age है, when do I consult a doctor कि अब मुझे fertility plan करनी है या मुझे नहीं करनी है, I want to postpone things or whatever. So, a brief overview में अगर if we see the female fertility timeline, so nature wanted it that 18 to 24 is technically the best age to procreate, but it stays the same till 25 to 30 years of age. After the age of 30, they still have a good potential of getting pregnant, but the odds start declining. हमें problems थोड़ी सी शुरू हो जाती हैं. And during the timeline of 36 to 40 years, there is the maximum reduction in the fertility potential. And beyond the age of 40, when we're looking forward to 41 to 45, the chances of conception decrease further as the body starts preparing to rest for its menopause. So, अगर हम देखें with age, the chances of having a successful natural conception, naturally हमें बिना किसी aid के हमें pregnancy रह जाए, वो gradually with age decrease होते हैं, and there is a significant reduction at the age of 40, which is just 5% at the age of 40. So, अगर हम aging होती है, now if I am getting pregnant easily at the age of 40, say for instance, now is there any other effect on the pregnancy outcome? So with aging हमारे जो genetic problems होती हैं, जो aneuploidies हैं, जो हम देखते हैं कि chromosomal problems निकल रही हैं in the fetus या बार बार abortion हो रहे हैं, ये इनके chances बढ़ने लग जाते हैं as the age advances. And when we said about the ovarian reserve हमारा decline होने लगता है beyond 38 to 40 years of age. So when we talk about ovarian reserve, what do we exactly mean? मतलब why is this such a hoo-ha about the biological clock, reserves decline हो रहे हैं? You all must have heard somewhere कि भाई हमारी जो eggs हैं, every lady is born with only a few set number of eggs. When you talk about the numbers, you'll feel it is very big. Like 6 to 7 million eggs होते हैं at जब आप as a baby अपनी mother के womb में होते हो at 20 weeks, and you are born with 1 to 2 million eggs at birth. But out of all these, only 400 to 500 eggs are going to ovulate. Ovulate मतलब वो release होंगे and would result in a successful pregnancy outcome. And ever